Let's talk about post-COVID symptoms, the residual symptoms that can occur after an infection from COVID-19. Now, some of these symptoms could last for weeks or even months, and they really depend on how intense was that infection. Was the person in the hospital? Did it go deep into the lungs? Did it create scar tissue? Are there pre-existing conditions on top of everything? Blood pressure, obesity, heart disease, cancer. All these additional factors are just going to prolong the recovery phase. What is the age of the person? And what is the current stress? I think this one is many times neglected, because if a person is under stress, usually by, situations or even people, it can take a very long time to recover because they're stuck in the stress in their environment, and you need a very supportive environment to heal. So if there are current people or things that are stressing you out, do whatever you can to minimize that. And believe it or not, the less stress the person has, the faster the recovery. Now, what you have to realize is that all the symptoms that someone has from COVID and other viral infections are actually caused by the person's own immune system. It's the inflammation. It's called cytokines. And that is creating all the symptoms. In addition to that, the residual symptoms are also coming from the person's own immune system. So why does that matter? Well, we want to focus on the immune system. So the post-COVID symptoms, the top one would be fatigue, and then number 2, shortness of breath, especially when the person exercises, coughing, joint pain, and chest pain. There can also be additional symptoms: depression, headache, fever that comes and goes, a loss of taste or smell, heart pounding or palpitations. So there are various things that can be done about this to pull a person out of, let's start with these symptoms right here: depression. Vitamin D, minimally 10,000 IUs, probably 20 or even 30,000 IUs will really pull someone out of depression. Headache, increased sodium, more sea salt. Himalayan sea salt is the best. If you're going through a fever that's coming and going, calcium lactate is one of my favorite remedies for fevers, especially if someone is younger. Loss of taste or smell, that means you need zinc. Heart pounding, more potassium. Also, a good thing to do would be to try to sweat, like when you go to bed at night. Wear some clothes, a sweatshirt, keep your room really hot. Take periodic hot showers or hot baths, which are actually inducing a fever that will speed up the recovery time. Far too often, people try to get rid of their fever too quickly, and that prolongs the infection. So realize the more medications that a person takes when they're going through the infection, that could be the thing that can inhibit their immune system and increase the duration of the infection. Okay? So this is some things that I would recommend: vitamin D, zinc, and vitamin C. These 3 nutrients are an absolute requirement, actually going through the winter months as a prevention, and especially if you have COVID symptoms, and you want to take these as early as possible. Vitamin D, minimally 10,000 IUs per day. Zinc, 1 to 200 milligrams per day. Vitamin C, 500 milligrams per day. I would recommend this being a food-based vitamin C. Now, since your own immune system is creating all of the damage and the residual symptoms, vitamin D is going to drop inflammation, so you're going to instantly feel better. Zinc also is going to strengthen your own immune system, so you can complete the immune cycle a lot faster. And vitamin C will also act as an antioxidant to prevent all the free radical damage that occurs when you're going through an infection. Frequent naps with additional sleep. Try to get as much sleep as possible, because you want to let your body heal, and it heals while you're sleeping. All sorts of magical things happen to your immune system when you sleep. If you don't get enough sleep, it's going to take a lot longer to recover. No alcohol or sugar when you're trying to recover. It's going to set you back. This is why we always recommend you do healthy keto. And if you're new to my channel, I put a link down below for that. Intermittent fasting So do not consume a breakfast. Don't eat snacks. Eat infrequently, 2 meals a day or even 1 meal a day. And what's going to happen, you're going to strengthen your immune system. Your immune system is actually going to get stronger when you do this. Now, I would recommend taking apple cider vinegar. Take a good tablespoon in a glass of water a couple times a day. That acidity is going to help stimulate something called phagocytes, which is going to help clean up some of this immune damage that's going on. Ashwagandha is one of my favorite adaptogen herbs that can help strengthen the adrenal and help speed up recovery, because usually the adrenal is what's weakened when you have slow recovery. If you can recover fast, you usually have good adrenals. Ashwagandha is a good one to help support a healthy adrenal gland. And then cordyceps, which is actually a fungus. It's very powerful. It's been used for a very long time. A lot of different cultures use it, and it can give you the edge and pull you out of some of these symptoms right here. And lastly, if you have not heard about my free immune course, it's called Bulletproofing Your Immune System. You should definitely take it to strengthen your own immune system. I put a link down below. Check it out.